Multiple times a day, staff at this Toronto hospital now perform a delicate dance. This woman in her early 60s tested positive for COVID-19 a few days ago. Struggling to breathe, she had to be intubated. This ventilator, a breathing machine, is keeping her alive. But now she has to move.
Our ICU now is currently completely full.
The hospital's intensive care unit, home to the sickest patients, is overwhelmed. They've even built makeshift ICU additions with extra beds in other areas of the hospital, but they simply don't have enough staff.
There's a profound shortage of ICU nurses.
So they work the phones, calling other hospitals in the region. And they found one in the small community of Aurelia, about a 90 minutes drive north, which has agreed to accept the patient. The challenge is getting her there. Orange is an Ontario nonprofit that provides air ambulance rescue and medical transportation services. They've been shuttling patients to hospitals for more than 40 years, but they've never experienced anything like the past couple of weeks.
There's nothing we can compare it to. It is the most busy we've ever been.
More than 1,200 COVID-19 patients have been transferred so far this year, nearly half of those coming in just the month of April. They rely on a small fleet of ambulances, a dozen helicopters, and they've just borrowed some buses equipped to carry 2 COVID-19 patients at a time.
They have portable machines and they have portable monitors, so everything is miniaturized to be able to do that.
This bus is transporting a couple of COVID patients from the Toronto area to another hospital 3 hours away in Kingston.
So right now, a lot of this accelerated transfers has been to try to get as many people out of the GTA as possible to fill up places like Kingston and those outside.
But as a result, Kingston is now filling up and moving some of its patients to Ottawa, while others head to different smaller communities across the province.
Is there an element of risk in moving some of these patients?
There's always risk, even just going from here in the hospital if you were to go from one floor to the next floor.
But so far, no COVID patients have died in transit. Hospital staff say they only move those who are in stable condition, and they no longer require the family's consent.
And that's the hard part. And unfortunately, we're in a system where we often have no choice because otherwise we would not be able to support everybody.
Jeff Semple, Global News, Toronto.